If you don't know, I'll introduce myself. My name's Jeff Turcott, and
I'm Kelly Kurtz.
And we are the owners of Simply Well Seniors and Simply Well Simply Organized. And this is the Simply Well Seniors Aging Well Seminar Series. And this is our third year that we've been doing this. Second year here at this venue. But we have a great program for you today. We have great programs for the rest of the year as well. But first, I'd like to introduce our sponsors. We have wonderful sponsors this year, and our platinum sponsor this year is Sunrise Senior Living. And we have Corrine Day from Sunrise, if you wanted to say just a quick word.
How's the coffee?
Hi, I'm Corrine Day. I work at Sunrise Senior Living in Leominster. Our community has been, building was built in 1996. And I feel like we're on the cusp of celebrating something. 30 years. But it's a nice community. It has, we have 70 apartments that range in size from 275 square feet up to almost 1,000 square feet. And we have also the same campus is a memory care neighborhood. So, please feel free to stop by sometime. I'm there Tuesday through Saturday. And if you have any questions, you can ask me afterwards. But thank you so much for coming and supporting our lovely Simply Well.
Thanks, Corrine.
Yeah, thank you. We were just at Sunrise this past week for a meeting, and they had beautiful snacks and food for us, and they supplied the scone, the pumpkin bread today. So help yourself to that. There is coffee and waters and stuff back there. So if you need to get up and get some, please help yourself to that.
And also we're sponsored this year again by Haywood Wakefield Common. They are our pioneer sponsor. They came on board the first year that we had this.
They believed in us first.
They believed in us. So Sue from Haywood Wakefield is here as well.
Yes.
Good morning, everybody. Yes, my name is Sue Kelly, and I am the resident transitions coordinator at Haywood Commons. Haywood Wakefield Commons is an affordable assisted living, and we are located in historic downtown Gardner, and we work closely with Sharon and the whole team at Summit, Pace, and if you ever want a tour, please give me a call, okay? Give anybody a call. We are always open for tours.
That's right. Thanks, Sue. Nice to see you as well.
And there are brochures and business cards for all of our sponsors, and there will, as well as the PACE Summit ElderCare program at the back table. So after you are done today, make sure you grab some of their cards or information if you want more information about the programs or of any of the folks you hear from today.
And we'll hear from Amma a little bit later in the program. And Life Care Centers of America in the Highlands, they're also came on board this year, sponsoring the seminars. So we're also sponsored. We have Keith here from Next Level Studios, who has been videotaping these events for our library. They are all available on our YouTube channel. If you missed a seminar and wanted to go back, if you wanted to send it to one of your friends and say, boy, this was some great information, you could send it. They are on our website as well. And Next Level Studios does a great job for us.
And Keith gets the award for best perfect attendance. He's been with us from day one. He's been at every seminar.
Keith.
Yes.
That's great. A little bit about us, for those of you who don't know, Kelly and I are realtors, but we're different. And we help seniors navigate the journey to the next place they call home. Even if that home that you're currently living in may be to a first floor and you're making arrangements to age in place. And that's what we're going to talk a lot about today is services that can help you age in place. But we can help from, we call it a couple different things. We can help from soup to nuts. We can help the whole schmear, everything, the kitchen sink, the whole thing. We can help you. We actually just met with a client, potential client yesterday, and we had helped her brother and sister-in-law move last year. And she said, the last conversation we had with her last year was, if you're still in business 5 years from now, I'm going to give you a call.
Wow.
Well, she called over the weekend.
Well, it's one snowstorm too many for her. She's decided she's going to downsize.
Yeah. And she said, I need help with everything. So we said, well, you called the right people. We'll help you with everything. And we'll start with, let's see what your septic system looks like. Let's get that tested first and then figure that out. But we advocate for finding where you're going to move first and navigate what that is. And she's actually looking at places in Marlboro, in Hudson Assisted Living, in
Northborough.
Hudson, Northborough. So she's narrowing down where she's going to go. So we're going to assist getting her there first and taking what will fit in that apartment or the assisted living community, what will fit, and do some space planning and that kind of thing. Get her all situated, moved into that apartment, and then we'll go back to the home and dispose of what is left, either consign it, sell it, an estate sale possibly, list a home for sale, and then she'll have money in the bank. So it's the everything else that seems to be the work. And by the time we get to sell the house, it's like, oh yeah, we got to sell the house too. Okay, all right. But all the work to line up to that, we find is really important. She's living this out. They bought this house in '76.
Yeah, they had it built.
They had it built. Yeah. So this is
her
your
husband
house.
died 7 years ago. So she navigated on her own, and she's now ready to make the move. So it's an emotional journey for most folks because every memory you have is in your house, especially having lost a spouse. There's a lot of sentimental value. So we're very empathetic to that, and we take the time to sit with people and listen as we're sorting through their things to make sure that they can process it correctly without feeling like they've lost control, because that's very important to this piece of the next journey, feeling like you're doing it on the way you want to do it with assistance.
Correct. Yeah. So that's about us. So today we have a wonderful panel, and what our goal today is we're going to break down how Summit ElderCare and their team coordinates some of this care and services for folks that are still in their home, or living on their own. Some you do some services in some assisted living as well. So we're going to show you how an all-inclusive model of care can help people stay safe. And again, we advocate for aging well, doing this the best way you can do it over these years. So, how many people here? I'm kind of pandering to the crowd here. How many people know about the PACE program in ElderCare? Okay, all right. And I'm sure some of you are wondering, what's this all about, and what's out there and what's available. So that's how we're gonna get into this today. So today we have Sharon Noley in the middle. Let's give Sharon a round of applause. Thank you very much. Senior Account Executive at Fallon Health. We have Vivian Murdoch, who is a social work manager in Leominster. And we have Lindsay Allen, who is a nurse with Fallon Health as well. And we have some questions that we gave you in advance, but we're not going to ask you any of those. That's the joke. No, we're going to ask you those. And we will have time afterwards. They'll stick around.
Yeah, super. All right.
For questions as well.
Our questions, so we can remember what they were.
Right. How long ago did we write these questions?
This morning. No. All right. Everybody hear okay and see okay?
I'm going to push up a little bit more. There you go.
All right, super. So I used to work at Fallon at Summit ElderCare, and my first career as an occupational therapist. So I've known Sharon and Vivian for a long time. Lindsay, I haven't met till today, but I've heard wonderful things about her, and they're from the Leominster team. Sharon, you kind of are all over the whole program, but this local Summit ElderCare is in Leominster, down by the old Searstown Mall, or the mall at Whitney Field. So if anyone's not familiar with where that is, it's a beautiful building. And it's a great, great program. So we're going to learn more about that as we get into some of these questions.
So I'm going to ask you folks can share this microphone. Check test, check. Phoebe, why don't you check that? So as we ask your, hit the button. And try any time here. Check test. There you go.
Hi, Sue.
Healthcare workers aren't technology savvy. I'm not either. It's just, we're not used to this.
We're doing our best.
Yes. All right. So I guess we'll start with our nurse guest today, Lindsay, and we're going to talk a little bit about the mission and eligibility of the PACE program. So there's a nursing home level of care threshold, and we talk about that the participants who come to Summit must be certified as needing a nursing home level of care. So a family who's watching their loved ones struggle at home, what are the specific red flags or daily challenges that suggest they might meet the criteria for the PACE or Summit ElderCare program?
Thank you. Great question. So in my role at Summit, I have the privilege of overseeing the enrollment of all new participants to the program. So myself, the team of nurses that I work with, we are the ones that go out into the home and kind of have those preliminary conversations to understand, is this person eligible? And also, what is it that we can maybe do to help them? So I think when people hear that you need to be nursing home eligible, our mind kind of immediately goes to folks who need the most help that we can think of, right? People who really aren't able to manage anything day to day on their own. And while, of course, they would be eligible, what the state is really looking for are people who just need some support day to day, right? You might still be independent in some ways, but maybe cooking is becoming more challenging. Maybe cleaning up the home and doing laundry is becoming a little harder than it used to be. So the state is looking for some help that you might need with taking care of yourself day to day, whether that maybe just is a reminder for something, right? A reminder to take your medication, maybe someone to set those medications up for you, maybe someone to just be there while you're taking a shower to make sure you're safe if you've fallen in the past. So those are the kinds of needs we're looking at, are just those day-to-day activities that are so important to all of us that maybe we're starting to need a little help in. And I think when I'm often speaking with families, what should you be looking for? I think the key thing to look for is changes, right? Something new. Now mom is asking, or a friend or a neighbor or a spouse is asking you for help with something that previously they were not asking you for help for. And I think where PACE can really make the biggest impact is when we're able to come into a situation and kind of prevent some of those, kind of crisis situations that we sometimes often find ourselves in, where now there's this huge change and we're not really sure what to do. So I would say if you have a loved one who's, just starting to show some changes and is starting to need more support day to day, I think that's a great place to start and to reach out to us. We assess eligibility internally. So it would be myself or one of the nurses on my team that would go out as a representative of the PACE program, and we do that assessment. So, there's no harm in, sending someone to us, even if they're not eligible yet. We might still be able to connect them with a lot of resources, or keep in touch with them as time goes on.
Right. Wonderful.
That's important what you said about seeing changes, and changes can be subtle.
Yes.
And certainly when there's a husband and a wife, it sometimes wind up operating as one, and
Yes.
and they're not really seeing the changes in each other. I find that with my own folks, that it's the both of them together. If I'm talking on the phone to my mother, I'm really talking to my father, and vice versa. Which is
The spokesperson.
Right,
There's always a
which is-
spokesperson in every situation.
which is fine. But to stand back from it, because I don't see him every day. Someone like me and my sister, who doesn't see him every day either, can notice something that's different, and dad may not notice about mom, and mom might not notice it about dad. So.
Yeah. And I think, it's day-to-day changes like that, but it also can be changes to medical status, right? If you have a loved one that has been doing pretty well, but now, over the last year, they've been hospitalized a couple times. It's like, that's a new pattern. Maybe there's something PACE can do because we're providing not only support at home, but we're also providing medical care. We can often intervene in these situations and kind of stop that cycle. So I think it's changes day to day, but it's also, new diagnoses, having complexity to the care you're receiving, and you feel like you're managing so many different doctors and specialists. Some changes in those places too, I think we can really help.
Excellent. I just want to make one clarification. We're interchanging the word Summit ElderCare and PACE. And so for anyone that doesn't know, PACE is an acronym for Program of All-Inclusive Care for the Elderly. So it's called the PACE program, but it's known as Summit ElderCare or Fallon Health, or just Summit ElderCare. I know I'm probably interchanging Fallon and Summit, but
We have a lot of names, but
yeah,
yes.
a lot of different names. But
PACE will
basically,
get you there.
PACE will get you there. Yes. All right. So the next question I have is for Vivian. So I wanted to ask a little bit about the integration of the interdisciplinary team, otherwise known as the IDT. So I know from my experience working at Summit, we would have an IDT or team meeting every morning to kind of discuss the clients in our program and, who was in the hospital or who was declining or who was doing well or different things. So it was kind of a really good collaboration, almost like a case management system of who's in the program. And so most seniors deal with a fragmented system, we find, of different doctors, different pharmacies, separate therapists. No one seems to talk to each other. You have multiple specialists a lot of times. And can you tell us a little bit, about how the interdisciplinary team at PACE works? And let's see how the team works. Where's my question? How it works. Yeah, and to ensure that everyone's on the same page. So kind of how you integrate everybody together.
And yes, we still do have that morning meeting every morning at 8:30 discussing
Do you
our
miss the
client.
morning meeting? No.
The coffee.
Yeah, so we still do
And the
have the
company.
morning meeting every morning at 8:30 if anybody's in the hospital or a SNF to discuss those high touch participants is what we call our enrollees. And we do have a lovely contracting department that works tirelessly to get us contracts for specialist vendors, facilities, such as Haywood Wakefield is one of our contracted facilities. And they work very closely. The provider and the care team works very closely with those contracted facilities and specialists and vendors to break down the silos, as you're talking about. The providers have access to participants' medical records, such as Epic is one of those medical record
Portals or
yes,
online.
yep. So the
yeah.
provider can go in there and access participants' records that way. Our care team, which I'll talk more about later, also have access to other records as well. Our business office, we have a business office at Summit as well that can request records for our participants. So the providers can review those. So if we're coordinating care, we know what happened at a specialist visit, so we can provide the necessary transition of care that's needed. So for instance, if somebody goes to ortho, an ortho specialist, and there's needs there, the rehab team and the provider can review those records, and then when they meet with the participant, can talk with them about what the next steps of what's needed there. So we have that connection. In terms of the pharmacy as well, we do have contracted pharmacies, and then our nursing or provider will reach out and name first name basis sometimes is what we go by there as well with some of our pharmacies, and our registered nurses and our providers will connect with the pharmacies to ensure that the pharmacological needs are met.
Okay, so let's ask Sharon a question now. Your turn. So we talk about the no copay advantage and the promise of no copayments in integrated Medicare and Medicaid sounds almost too good to be true for many reasons on fixed incomes. So are there any hidden costs families should be aware of, or does the program cover most everything from aspirin to ambulances in a general area? Now we know we're going to make a caveat that everyone has a specific situation. So if you have specific questions about your eligibility and finances and things, those are good questions to have an actual sit down with the team to talk about your specific situation. So just more in a general sense, how people, I always felt that Summit covered so many things for folks that Medicare and Medicaid wouldn't, especially as a therapist. I would see equipment. If you needed a shower chair for the bathroom, or you needed a walker or a cane, or you needed some utensils for eating that were built-up handles, something like that. A lot of times Medicare, they wouldn't cover any of that, but Summit would cover it because they knew it was important to keep you independent and in your home. So if you want to talk a little bit about, I know that was a roundabout.
So the answer is probably, yes, in most cases, but we pay for like hearing aids and eyeglasses and dentures and dental prescriptions, over-the-counter drugs, even like poise pads and Depends, that type of thing. So the way it also works is if somebody were to be able to get onto Mass Health and their income, can everybody hear me?
Yes.
Is $3,002 or less a month, and they show less than $2,000 in assets, and they can have a house and car, then they're able to get the services at no cost. It's paid for through Mass Health and Medicare. And what we do, Fallon Health Summit, is we work with the families to gather all the paperwork for the Mass Health application, and then we do the Mass Health application, and then we work very closely with Mass Health if there's any questions that they have, or if there's any, we call them RFIs, requests for information. And there's a lot of them. It's just something that Mass Health is doing now. But we work all of the RFIs, we work with the families, and it really, truly makes it so much easier because these Mass Health applications are a lot of work, and we are the ones that are doing it. So I don't know if that answers your question.
Yeah, that's a huge advantage. If anyone's had to fill out that application or knows someone, it's wonderful to have somebody helping you with that whole process, because
Yes.
that paralyzes a lot of folks. They just can't get through the paperwork oftentimes.
Yes.
Yeah, wonderful. Right.
I'm just trying to keep up with the acronyms.
Oh,
I know there's a lot of acronyms.
RFIs. Request for no, you're very good.
This is why no one raised their hand when you asked if anyone had heard of PACE before, right? It's too many words.
That's right.
That's
All
right.
right. So let's go back to Lindsay. So safety at home. So how does the PACE program determine if it's truly safe for a senior to remain at home versus going to maybe an assisted living or a long-term care facility? And what home modifications or safety assessments does Summit ElderCare provide to make sure aging in place is a reality?
That's a great question. I think as time moves on, the desire to remain at home and age in place is becoming more relevant than it has ever been, right? We know that there are not the availability of beds in nursing facilities the way that there once were. So I think the need for PACE is only going to grow as time goes on. And as you kind of stated at the beginning, our mission is to help people age in place and to avoid nursing home placement for as long as that is possible for them, right?
Mm-hmm.
So all of the things we do are part of our individual plan for each unique person who is enrolled in our program. So as you said, we provide medical care, we provide insurance, we look at what's going on at home to make sure they're safe. And what we're looking for to say that this person can be managed by us is just that their safety is not going to be in jeopardy by being supported in that home environment. So that nurse that is going to come out initially and talk about things like eligibility and what help someone needs, that nurse is also assessing the safety of their environment. It is our goal to be able to support everyone who is eligible and who would like to remain at home. That is our mission. That's why PACE has been around for as long as it has. We've been in Massachusetts for 30 years. But some things we look at are just, do you have a way to call for help? right? Should we maybe help you with like an emergency response system if grabbing that cell phone when, if a fall happens is not going to be a reasonable plan? We might ask our physical or occupational therapy teams to go in to look at any kind of home modifications, equipment needs, grab bars, ramps, devices like shower chairs, things like that, to make sure that those things that everyone needs to get done throughout the week are being done safely. That is kind of what we are looking at. We wouldn't go into a situation, just assess but not give recommendations. That assessment that we're doing is coming with recommendations. Mm-hmm. So if we go out and we can identify some areas that we think we could give some, support to, we're going to try everything we can to make that situation work. Now, if someone truly is not safe at home, mm-hmm. so I would say the most common example of this that I see is sadly someone with pretty progressed dementia or Alzheimer's who is living alone, and it's just not a safe option for them. We might at that point make a recommendation to look at some of the wonderful assisted living partners that we have in the community. And I think it's interesting to know that more than half of all of the patients we take care of do live in assisted living. So that is a partnership that has worked very well for PACE because we're that medical piece. So we would give recommendations. If the only option is a nursing home, we would also give that recommendation. But I think then you've done your due diligence, mm-hmm. right? I think from my perspective, a PACE program is probably the highest level of support that is available in the community. So I think starting with PACE and letting us, come in and do our assessments, it is our goal to help everyone. We just want to make sure everyone is going to be safe. And some other things we might look at as well is part of what we do is also our day program. I don't think we've touched on that yet. But in our center in Leominster, people are coming in, spending the day, having a meal, doing activities, socializing. But we also can use that day program to provide supervision and to support for someone who really can't be alone during the day, right? Maybe they live with their daughter or their family and those people are working. So those are some other recommendations or things we could put into a situation to make something work that maybe isn't working.
Wonderful.
So, yes. So tell me a little bit. I'm going way off script here. Okay,
I can handle it.
So I'm interested in what happens during that day program. So give me a typical day in the life of someone that is eligible to come to the day. And do they come every day or that kind of thing? So if I'm going to say it. Say my mother's living with me, and she can't be home alone during the day necessarily, and she goes. So how does she get there? What happens while she's there?
So various ways. 2 ways you can get there. It could be family transportation to and from, or one way, or we have a contracted van company, Need a Lift. That transport participants to and from the program as well. And once they come in, and feel free to come for a tour. Anybody who has never been to our Leominster site, feel free to do so. They are seated with pairs in the day program. And there's activity staff in the room. There's health aid staff in the room. The nursing office is right outside of the day program as well. There's always a nurse in the room. There's a quiet room if you need to take a nap, that's in there as well.
Wait. If I need to take a nap?
If you need to take a nap, or if the room gets too, over sensory wise, you can, relax in that room.
I like that.
There's activities from the minute you come in to the minute you leave. I happen to do a group that's called the Chit Chat group on Thursdays from 1 to 2, which we just chit and chat, but they love the group anyways. We talk about everything except politics and religion and a word that starts with S. But they all love the group. And so there's activities and there's a hot meal, like Lindsay says, we have a catering company that brings the meals in. And then once you're there, all the disciplines are there. So Summit ElderCare, the PACE program, we have a care team and all the disciplines are in the building. Our offices are, we're like in a circle, I would say, right? A big loop, right? And then the clinic is there as well, where they see their the provider, because the primary care doctor is there along with all the other disciplines. And So if anything is going on with anybody at the day program, they're right there. They can be seen. Folks can come in up to 1 to 5 days a week, right? Depending on their situation. So like Lindsay said, if there's a caregiver that works 5 days a week and somebody can't stay home, they're there 5 days a week. If it's 1 day a week that they need to come in for some socialization, we can do that. Or rehab, right? They can come in for rehab. The rehab office is right off the day room as well. Kelly knows that. So there's various reasons. You have a question?
Areas where these programs are available, like we live in Temple. What's available in Templeton Gardner area?
Yep. No, if I were to show you a map of the entire state of Massachusetts, you would see that we pretty much cover the entire state. So we do cover Templeton. We have 6 sites across the entire state. Leominster would be the closest to where you are. But our service area, besides the tip of the Cape, which I have volunteered for, besides the tip of the Cape and like Pittsfield and most Western Mass, we cover the whole state. So depending on where you live, let us know. We can kind of let you know which site would be closest to you. We have another facility in Worcester, right in the center of Worcester. We are also up in Lowell, Massachusetts, Dartmouth, Massachusetts, Springfield, Massachusetts. So we're all over the place. Great question. Yes, yes. Yes, and I think it's important to know as well, although we have many different sites, the team at each site is focused on the participants of that site. So Vivian and her colleagues in Leominster are only taking care of the folks who are enrolled in that one center. So it's very much personalized in terms of the care.
Yeah, just to add to that, I would know that everybody on the team knows everybody that are the participants there, just like Lindsay's saying. So when you walk into the day room on your way back to rehab or to the nursing office, you know and recognize all of the participants. They know you by name, you know them by name, or they at least know your face. And it's a very family-like oriented feeling when you're there. One thing you forgot to mention was the hairdresser.
Yes.
There's a hairdresser
Before
there.
COVID, we haven't had a hairdresser, and
Okay.
for a little while there wasn't, and now we have a hairdresser again.
Yeah.
And she goes to other sites as well, not just the Leominster site.
So it's nice for families if mom or dad need their hair cut or done, they can get it done while they're there. And in addition to seeing the doctor, the nurse, the therapist. And I know what we would do an annual screening on everybody, even if they weren't getting therapy, everybody on the team sits down one-on-one with each participant and goes through all of the things that they're looking for. So you get, even if you're not in need of a lot of services, keeps cutting out, but it's really nice is my point, that it's very personalized. So you really feel like you can talk to somebody. I know a lot of times with doctors, you're in and out and just, you only have a few minutes with them, but here you can really spend time and ask questions, and they listen to you and they can assess you pretty much on a daily basis if needed. They're really available.
Yeah, that's what I was going to add, Kelly. So each provider has about 60 to 65 people on their panel. And like I said, you have like an 11-man discipline team, which I can share, but I know that's one of your questions. So I don't want
You can talk
you want to jump into that? Yeah.
Sure.
So you will have your care is planned and provided by your care team, which constitutes of a primary care doctor, okay, a social worker, licensed social worker, registered nurse. There's a dietitian and staff as well. We also have rehab, PT, OT, speech therapy, all in-house, transportation coordinator, home health aide, activity staff, like I mentioned earlier, home care nurse, because once you enroll with us, we want to make sure that your home things, like Lindsay mentioned earlier, is equipped enough to keep you safe at home, whether it be grab bars in the bathroom, things like that, hospital bed if needed, those kind of equipment and things. So there's about 60 to 65 people we have 4 panels in Leominster site, and we know everybody by name and all their needs. So that's how we operate, and it's like Kelly said, it's we sit with you for as long as we need to sit with you. Your first physical with the primary care doctor could go up to 3 hours because they do a head to toe physical. It's not like a quick 15-minute in and out. visit. So that's really also a good thing as well.
Who's ever had a 3-hour physical? Anybody? I mean, it seems like a lot of space to cover for 3 hours, but it's true. They look at everything, and that's really wonderful. Wonderful. Sharon, I want to ask you a little bit about the transportation as a lifeline.
Yes.
We know that, transportation is often the biggest barrier to a lot of folks. And we talked a little bit about it already, but how does the PACE transportation system work for someone who has limited mobility, and does it extend beyond just trips to the day program? What other services are available?
So it does include the trips to the day program, and then we also include medical rides if it's needed, because there's many family members that really want to go to the doctors with their loved one to make sure that they're communicating correctly.
Mm-hmm.
So in that case, obviously, it isn't needed.
Mm-hmm.
Okay?
But if someone had a situation where they needed to get to a program or to an appointment and the family couldn't be there, in those cases, it would be considered.
As needed. Right.
Yes,
That's
as
the
needed.
situation, right?
Okay, wonderful. Great. Let's see. I guess this will be back for Vivian about the socialization versus the medical care. I know we talked a little bit about this already, but the PACE Center is described as the hub of the network. How do you balance the clinical needs with the participants for the social engagement and mental stimulation?
So like I said, at the day program, at the PACE Center, the clinic is located there as well. So a participant, and not all our participants come to the day program, by the way. Some people are at home and at the assisted living, they already do a lot of activities there. So a lot of them don't come in, but some do come in because they have medical needs or need for socialization, things like that. So they come in, and if they need to be seen in the clinic for their medical piece, that's taken care of. And then the family can bring them in, or transportation again can bring them in. Or for the day program, if they need to get out for family to get respite or things like that, they can come in for that socialization piece. As their health needs change, that's when we look at how often they can come into the day program. And also how often they get seen by a provider, nursing, things like that. Our nursing actually goes out at least once monthly to check on each participant, whether they come into the program or not.
Mm-hmm.
So we do make house calls as well. And I keep saying hi, Sue, because I'm at Haywood Wakefield at least once a week, visiting with folks, because we have like 40 something people there. And I think I'm the social worker for most 40 people there. And I see Kim from Manor on the Hill. Yes, hi, Kim. Yes. There's another social worker that oversees Manor on the Hill. So, yeah. So they come in and all their needs are met there at the PACE Center. It's a one-stop shop, is what I would say, right? For the rehab, medical, social piece. So everybody's care is individualized. So once, a specific need comes up, that's when we huddle as a team. We come together as a team, not just our interdisciplinary team that comes together. We loop in the participant. We loop in the caregivers. We loop in whoever is involved, whether it's a VA veterans worker, I'm not going to use an acronym, a veterans worker or somebody, whoever is on the participants team is who we loop in to cater and tailor to that specific need as they come up.
So you mentioned caregivers.
Yes.
This also sounds very beneficial to a caregiver to be able to have their loved one have some socialization, that kind of thing, and then to give that caregiver a little bit of
respite time is what we call it.
I know, I don't know if this is still the case, but I know there were certain participants who needed help getting washed and dressed in the morning before they would come to the program. So do you still offer home care services to help them to be able to come?
Yes, if that's a need that's identified, we do put in home care services for cleaning, laundry, shopping, bathing, dressing, hygiene, the whole bit. If that's a need that's identified and the team agrees and we talk with the participant and our caregiver, absolutely, that's something that's offered as well.
We do. Yes. Yep.
Because Worcester Way used to be on East Mountain Street.
It did. We used to have 2 sites in Worcester. Yep. Now we're on Grove Street. But I think when you kind of were talking about caregivers too, this program can very much be kind of a lifeline if you are providing care to a loved one, a spouse, a family member, an aging friend, and are just really not sure where to start, right? Navigating the healthcare system can be very challenging, and communication from all the people that you're trying to have help you, right? They're all scattered. And I think that is what's different about PACE is, as Vivian said, it's your doctor, it's your nurses, it's your social workers that are the ones helping decide, what home care you should have, or should this equipment be approved? It's the people who know you. It's not, some unnamed insurance company that doesn't know you at all and wants you to have everything authorized, right? So we actually become your insurance company, and it is the PACE team that decides what is covered as long as there are needs for that. So I think eliminating that red tape is also a reason that people really appreciate the support of Vivian and the team.
Absolutely. That's great. So I don't know, maybe Vivian answer this one, or you can all chime in a little about the transition period of joining the new program. Sometimes it can be intimidating for folks. And what does the onboarding process look like for the new senior during their first 30 days or so in the program?
We've expanded that to beyond 30 days now for somebody new joining our program. Very high touch by the disciplines for 90 days. Okay. To just ensure that, because this program is very unique, I would say, but we're very involved. And when I do my enrollment signings or intakes sometimes, I say, even if your pinky hurts, we want to know. Because something small can turn into something big, right? So we want to know that. But within the first 30 days, all disciplines sit with you and they do an assessment to get a gauge of one, the social piece, psychosocial piece from my end, to kind of get a handle as to who you are, your background, things like that. Other disciplines will assess your function, like rehab, PT, OT, the medical piece. So within that first 30 days, it's very high touch. We either see you at the day center or we'll come to your home and visit. OT, home care nurse, usually goes to the home to make sure you're pretty much equipped in your home to be safe there with the needs that you have, and just get to know you. I know we say a lot in our morning meetings that we like to wrap our arms around you for that first 30 to 90 days so we can make sure all your needs are met.
I keep seeing the reoccurring theme here that you're really involved to get to know these folks and their families, and to really narrow down, narrow in on what their needs are, and not just a blanket. Oh, okay, that's what you need. Here you go, and send it off. But to really get to know some people and know their families and know personalities as well.
I know one example, and this is a few years back, but we had a family who the son was really important to him to coach a little league team for his grandson, and his mother was living with him, and she needed a lot of help. And he was trying to figure out a way that he could go do the coaching, but not leave his mother home alone. And so through the IDT, the interdisciplinary team, we decided that home care or companion care and some personal care in the evening for a shower and things would be the perfect window for them to come to the house and be with her while he went and coached the team. So it was really nice because they try to prevent caregiver burnout. And a lot of times if you're working and doing care all the other hours, it can be a lot. So this was a really nice way that I saw the team approve something that no other insurance company would ever say, oh yeah, you want to coach a little league team? We'll come and take care of your mother. Nobody would do that, but Summit did, because they knew that the value of having him keep his mother at home the other hours was so important, and it gave him that break. So that's just one example of some of the things that that I've seen them do that were really outside of the box. Really nice. I know we're almost about 11:30, and I want to leave time for questions, but I also wanted to just ask a little bit about how the care plan evolution comes to play. And I don't know if this would be maybe Lindsay and maybe Vivian about as the needs change for a client, if you could walk us through how the IDT or interdisciplinary team can adjust a senior's care plan if there's a sudden change in their health or a crisis occurs or a caregiver becomes overwhelmed.
Absolutely. So for all of our new participants, part of what the enrollment nurse team does is we meet with the team before you enroll to kind of review some of those needs that are present before you've joined PACE. So we're kind of thinking about care planning even before you are our participant, right? So that is happening from day one. That plan of care that the team puts in place is reviewed whenever there is a change. So I'll let Vivian kind of talk about, how when something comes up in that morning meeting, that might spark the team to be reviewing some of the elements of that care plan.
That's when we pull together as a team and also loop in the participant and or the caregiver. Well, usually we have meetings or many phone calls to say if there's an identified need. Say somebody is now struggling with hygiene issues. And we hear that from the caregiver, and then we just come together as a team with the caregiver, whether it be a meeting or in person, and it could be via Teams or something like that, and decide that, okay, this person could benefit from a couple of days a week of showers, and also help with getting dressed and things like that. Then we come together as a team and we say, okay, it seems appropriate. We'll approve it, and then the search goes on to find a home health aide to put in place to assist with that care needs. So as care needs come up, it's specific and individual to the person. We just together as a team, along with the caregiver and participant, come up with a plan for that.
We were going to ask a little bit about maybe a case study, if you could describe either a situation or something, how you've seen the PACE program be different from somewhere else maybe that you've worked, or typical healthcare. I know we were talking about a typical day for a patient that comes to PACE. We talked a little bit about that, but I guess maybe if you had anything else you wanted to add that we didn't ask you about that would highlight the benefits of the PACE program from a personal perspective that some of the audience might relate to.
Yeah. Well, I will say, full disclosure, I am also a caregiver to a PACE participant. My aunt, who was not able to have children in her life and didn't have any immediate family to help her when her needs started to change. So I have seen firsthand the difference this program made for me. And even as someone who has worked for PACE for as long as I have, almost a decade now, there were things that the team were doing for her and still do for her that I was like, wow, we really do all these things. So when she moved in with me, the team came out to my home and helped me make sure that I had a safe way for her to take a shower. She attended the day program while I was working. They would give her her flu shot without me needing to drive her to the appointment. She developed a wound from a fall. I didn't need to call a VNA to come in and help me with the wound care, although I would have done it myself, but she wouldn't have let me tell you. But I didn't have to go through all of these calls to get someone out to the house because she was going in and seeing her team, and the nurse from Summit, helped change that bandage and monitor to make sure the wound was better. When her memory started to decline and I was noticing some changes in how I was able to interact with her, they were really there for me, right? Helping me as that family member monitor some of these behavioral changes and give me guidance and advice, right? And then when the decision was made that maybe she would do better in assisted living, the team helped me with everything to facilitate that move, helped me with, looking at where would be a good option for her, and then supported her as we made that transition. So I think what we've kind of been harping on here is that although PACE is a very large umbrella, right? There's a lot of different things we do. I think the reason it's special is that we don't do the same thing for everyone. Right? So everyone has a different picture. Everyone has different circumstances. So PACE can really meet that need. And I think what I felt more than anything was that I had access to the information I needed to take care of her, right? If I had a question for the doctor called me. If I needed to have her be seen because something was new, she was getting in that the same day to see her team, right? I didn't have to wait days and weeks for appointments. And I think just having that support as a caregiver is hugely impactful. But I also think people who maybe don't have a caregiver in their corner and are trying to navigate this all on their own, having social workers like Vivian and all of the dedicated people she works with there to help be that access point for you, right? Like whatever the question is, you can probably start by calling the team and they're going to point you in the right direction. So I think that's what I would leave you with.
Excellent. Wonderful. Sharon, is there anything that you wanted to highlight that we didn't ask you? Because I know your role is really special for the program and you have a lot of knowledge. So if you want to share something else.
Yes, I can you guys hear me? I just wanted to say that these PACE programs, there's actually 8 of these PACE programs in Massachusetts, and there's about 200-ish in the United States. So they're all over, and they started in the 1970s in California. So it's not just like Summit ElderCare, Fallon Health. We're one of the 8, and we've been doing this for 30 years. So we're grateful to have each other as a team, and we're grateful to be here. I actually asked for this presentation was 6 or 7 months ago. So here we are, and it didn't snow. And then just a little bit of information about me. I've been in the industry for 25 years. I worked in assisted living. I worked for home care, and I've been with Fallon Health for 15, 16 years, and it's been such a great experience for me, and I really feel like I have a purpose, and it makes a difference. I was a caregiver for my mother. She lived till she was 100 years old, so I have a lot of knowledge, so you guys can use me as a reference if you have any questions. Yeah. Thank you.
Wonderful. All right, Vivian, anything else you want to add? Memory care, sure.
2 locations, right? Yep. Sharon is talking about the day program, and so we have 2 rooms, and we have a room that's called the Chapman Room for those folks who have memory impairments and is just so overwhelmed or sucked in by the bigger room where folks are more out and about and doing their own thing. So that room is also available to folks that have memory impairments. So we can do that. I have been with Fallon since 2016. So I've been, there is, right. So I brought my business cards. If anybody wants that or anything, feel free to call as well, and I can provide more information.
Lindsay has one more.
The only other thing I would add is that, all of these services are available, but oftentimes people do not know that PACE exists or that PACE is available. So now you can be one of our champions out there and sharing the message. Now that hopefully you'll know a little bit more about it, because we keep hearing that we're the best kept secret, right? We hear that consistently. So we're hoping to figure out how to not be the best kept secret.
Excellent.
So Thank you for having us today.
One other thing that I remember Summit doing a lot of is they really paid a lot of attention to people's feet and their footwear. And that was part of our role in physical therapy and occupational therapy. But we would have a podiatrist come in and look at their feet, I forget what Steve's title was, Prodosis, something like that. I don't know. You know what I mean? It's a foot person who comes in and specializes in shoes. And so he would fit people for their shoes. And footwear was so important for preventing falls. So one quick funny story is one day one of our clients came in and they kept saying, my foot's been kind of bothering me. It's really sore. And Phil, who was our physical therapist, was still there. We took the shoe off just to check the shoe. And lo and behold, we found a little round cat toy that was had a ball in it. And it was in their shoe, and they were diabetic. So they didn't know that it was in their shoe, but they were in it for like the morning and realizing something hurt. So, I mean, instead of just saying, oh yeah, it's probably okay. I mean, it takes the time to take the shoe off, really look at it. And there it was, the cat toy. So that's the level of care you get at Summit. We'll find the cat toy if it's in there. Yeah.
That's right. Finding cat toys in your shoes.
Yeah.
So before we open it up for questions, and we have a few minutes left for questions, we'd like to hear from Amma, our other sponsor, and Amma and her husband own Senior Helpers that also provide help in the home and can be a help prior to somebody going into a program such as PACE. But Amma, just say a few words.
All right. Hi, everyone. My name is Amma. My husband and I own Senior Helpers. Our office is located in South Street, Fitchburg, but we serve all of North Central Massachusetts, and we're a non-medical home care company. So we help seniors stay safe in their home as long as possible, and we help with, activities of daily living, cooking, cleaning, driving to doctor's appointments, personal care like bathing and all that. And we don't have like any minimum hours. So we've helped people from 15 minutes just to get in their car and drive to work to, whatever they need. And one of my favorite programs is called Return Home Program. So it's to help people who are returning home from surgery or from rehab. And we help them in the first week or two when they come home just to keep them safe so they don't return. So that's one of my very favorite programs. Like if you're going out to have surgery or something like that, you can reach out to us and we'll come to the facility to work with, your care team and coordinate your discharge. And, Sharon, I've met clients that I'm like, Sharon, can you help? I think they'll be a good fit for PACE. So I do that, we collaborate a lot. So this was a great presentation. Thank you.
Yeah. Thank you, Amma. We appreciate Amma's support of our seminar series this year as well. And, it's very, the in-home care piece of all this seems to be very important as well. So we'll open it up for questions.
What again was PACE for?
PACE, what's the acronym?
Yeah.
It is
All-inclusive care
Pro-
for the elderly.
Program of All-Inclusive Care for the Elderly.
Okay, thank you.
You're welcome.
Question.
Steve, I'll get to you, Carol.
A comment was made about a ceiling of $3,000 a month income, and it felt like, were you saying that the program's not available to people who make more than that?
Yeah, I was just going to ask.
No, great.
It sounded like that.
Yeah.
So there are no financial eligibility requirements for PACE. There are a variety of options. We have people who have very high levels of monthly income and they pay a premium for this program every month. That $3,000 is what Mass Health's threshold is. If you are under that, you would not have a premium associated with the program. But regardless of what your income is, whether you have a premium per month or not, there are no costs for anything the program offers. So there are no individual copays for medications, doctor's visits, home care, transportation, medical equipment. So some people pay monthly, but it's a set rate, right? Regardless of if you come to the program 5 days a week or you have, 1 day of home care or 4. Just hope that answers your question.
That answers your question.
So the age requirement is 55. We start at age 55. Yes.
Okay.
My clients are strictly private pay, but I know my future. We were just, should I stay or should I go program that we just had. I was in the yellow zone. You mentioned something about the $3,002 and then less than $2,000 in assets. But isn't the home considered an asset? How does that work?
Yeah. And, honestly, Mass Health, those requirements are Mass Health's requirements. And, we're not elder law attorneys. There's a lot of complexity to eligibility. In most cases, a home that you own or one vehicle is not counted towards that $2,000. But we are happy if there's anyone who is looking for kind of individual guidance about, with my financial picture, what would this look like? What would my assets look like? We have a team of people that specialize in Mass Health eligibility that work for Fallon that are happy to have those conversations. We don't charge for that. That's a complimentary thing we offer. We also have a network of elder law attorneys that are very familiar with PACE, and we're happy to connect people with those elder law attorneys who can look at more complex and actually give more guidance, right? We can certainly let you know what, these are the 5 things Mass Health requires. But if you're looking for guidance, that we would love to help you connect with an elder law attorney. Thank you. Yes, thank you.
Anyone else? Any other questions? No? Good. So that's all really good information. We appreciate that as well. And coming up in the coming months, actually, that we are, next month we'll be back here, assisted living options. We're going to have a panel as we have in the past, of local assisted living communities. That we're going to pepper them with all kinds of questions as well, and mix them up while we do it. That's always a fun panel. So right back here on April 8th. And then May 13th, we will have estate planning, trust wills, and guardianships, as Lindsay was alluding to, that an estate plan with an attorney about how these things are going to go is really important. And we've seen time and time again where someone that did plan and had these things in place, things go well for the family. Oftentimes, when it's not in place or it's a little too late, things can go awry and take time as well. So that's what we're going to be doing next month.
And please make sure you ask these ladies questions if you have individual questions, and feel free to chat with us as well. We love having you here. We appreciate your coming. And if you know folks who might benefit from either the next 2 seminars coming up or this series in general, please feel free to bring them. We always can set up another table. We love to have people. And thank you again for coming.
Later this month, Kelly and I are going to be hosts. Oh, no, not hosts. We're going to be guests of the mayor, Mazzarelli, on his Leominster Access TV show, Thursday night, the 26th. Have you been? Yeah. So
I don't know if anybody watches it, but we're going to be there.
We're going to be there. And we're gonna talk to them.
Yeah.
So that's great.
Yeah. So thank you, everybody.
So let's give these folks a round of applause. We'll see you next month.